Sweden has officially crossed the threshold of 3,000 deaths from the emerging coronavirus, registering one of the highest mortality rates to the population, amid controversy over the effectiveness of its approach, which relied on voluntary social separation rather than mandatory general quarantine. And recorded in the Kingdom of Sweden 99 new deaths of the coronavirus within 24 hours, which brings the total number of deaths to 3,040 deaths out of 24,623 confirmed cases of the virus in the country, with a population of 10.3 million people. Thus, the death rate among every million people in Sweden is 301, which is much higher than that of the neighboring countries, where Norway recorded 40 deaths per million, Finland 46 and Denmark 87. It is also higher than the percentage recorded in the United States, which has the largest death toll from HIV infections and deaths in the world, and has a death rate of 219 per million. It is also higher than the percentage recorded in the United States, which has the largest death toll from HIV infections and deaths in the world, and has a death rate of 219 per million. But it remains less than the worst affected countries in Europe, with Britain recording 443, Italy 491, Spain 558 and Belgium 726. Nevertheless, government-appointed epidemiologist Anders Tegnell told a news conference Thursday that the curves show that we have largely succeeded in keeping the level of the virus outbreak within limits that the health system can deal with. In the previous day, Tegnell described the death toll in Sweden as horrific. Criticism and praises. The Swedish approach to the epidemic has been criticized at home and abroad, but Swedish officials have insisted that their plan has sustainable benefits, and rejected short-term tough measures as ineffective. Sweden did not implement strict measures or exceptional closings, and left most schools, shops and restaurants open. I contented myself with urging people to act wisely and abide by official recommendations for social distancing and maintaining personal hygiene, and only prohibited gatherings of more than 50 people and visits to homes for the elderly. The World Health Organization has praised Sweden for its success in applying social divergence, and its ability to avoid strict closure measures has been attributed to the high public confidence in the government. The British Times newspaper mentioned the desired benefits from this approach, saying that some Swedish scientists estimate that more than a quarter of the population of the capital, Stockholm, have already developed antibodies to the virus, and if it turns out that Sweden is on its way to achieving what is known as the herd immunity, then its experience will be crowned with success.